by the time folks get to us, they have tried almost everything. They've tried almost every specialist, every pill, every doctor, every lab test, everything. We could operate on your stomach and take out 3/4 of your stomach, but it's still not operating on your trauma, your brain, your emotional addiction to food. And oftentimes we see that their addiction transfers to another addiction. Once we find that sweet spot, boy, it just poof, it just works.
We have with us today Michelle Phelan, who is one of our coaches at Revero, and we're very happy to have her. Michelle, I don't know if you know this, we had like 3,000 applicants apply for coaching positions. So we were able to get some very, very good people, and you're among them. So it's awesome to have you aboard. But you were saying that you're in Colorado now. Let me just ask you a little bit about your background. I know you've got a background in nutrition stuff. Tell me a little about who you are, if you don't mind.
Great. Well, I can start there. I got into this space, and again, I'm closer to your age. So back in the early to mid 90s, I was a little lost. I went to college in art, and then I realized, well, that was nice. Now what? So then I was working as a personal trainer, and got National Academy of Sports Medicine certified, and they had a little nutrition program as well. And I just loved it. And that really piqued my interest, I guess, in this, health and wellness space. And I remember that I had this aha moment. I moved down to Palm Springs, California, Southern California. Mm-hmm. And I was on the floor with one of my clients, and, working her through some core exercises. And we were just talking about how to lose weight. How do I, the gal was like, how do I get rid of, because remember back in the day, no one wanted a booty. Everybody wanted to look like Pamela Anderson, right? So we were talking nutrition, and I thought, gosh, I actually spend most of my time talking nutrition, talking about how to lose weight, how to feel the body, what to eat after workouts. And I realized, well, I better go to school and learn more about this. And so I went back up to Washington State, where I'm from originally, went to college at Central Washington University in Nutrition and Dietetics. And while that was fine, it didn't resonate with me. I felt like, how does this work in the gym industry? How, they didn't promote protein. They didn't promote red meat. They didn't, and it just didn't resonate with me. I realized I would end up working in a hospital with type 2 diabetics, telling them how to adjust their insulin, but they could eat whatever they wanted. And so I went back down to Southern California. My brother was down there, and I was just looking for, nutrition and personal training jobs. And guess who I stumbled upon? JJ Virgin. She had her studio there on El Paseo in Palm Desert. My world exploded. She was my mentor. That lady my brain blew up with everything that she was introducing me to. And while we were working in her studio, personal training, she was actually working on her PhD in we called it holistic nutrition back in the day, or integrative nutrition. Now it's functional nutrition. So she introduced me to all of the greats in the very beginning. And I get excited when I talk about this because, again, it was so profound in my life, made so many changes in my life. So not only did I learn so much from JJ Virgin, I was introduced to Dr. Mark Hyman and Lauren Cordain, the paleo diet guy, mm-hmm. back when paleo was at the very beginning. So I've been around the block quite a while. And from there, like I said, I just went functional and never looked back. I've had I feel really blessed and really lucky. I've just landed in front of some amazing providers and amazing practices. I did get my functional nutrition, certification. And then also I had a provider I was working for. She says, she goes, I tell you what, why don't you become a health coach as well? And I said, what is a health coach? What is that? And come to find out, there were some skills that I needed to learn as a nutritionist, right? I needed to learn how to help folks create goals, how to help folks navigate their feelings or their triggers, or how to create sustainable and meaningful results. And so my communication, becoming a board certified health coach, has really helped me with my communicative skills, and it's helped me be a far better nutritionist. Because you know how it is, you kind of tell people what to do, but it's like you don't give them the skills to do that. But with health coaching, it's kind of the best of both worlds. So that was another really great thing that I did in my career, was become a health coach. I also had the opportunity to learn again, my brain just blew up with this opportunity. I got recruited to work in a bariatric surgery center in Las Vegas, Nevada. And we moved down to Vegas, and it was a huge clinic. He had his own well, he was a surgeon at a couple of hospitals there, but then he built his own surgical center. And that practice was booming because this was before GLP-1s. And working with folks who are morbidly and clinically obese, 400, 500, sometimes 600 pounds, was eye-opening to me. And they let me have free reign. I taught pre and post classes as far as what to do, before your surgery, what to do after, how to reintroduce foods. And again, with my background, I was really focusing on protein first and eating, whole foods, which is not the norm in that industry. They just want folks to eat, sugar-free Jello and sugar-free this, and, and so that was a really fun challenge for me, and I really enjoyed that. Fast forward later, that's how I started working via telemedicine before it became a thing. My ex-husband and I, his company wanted him to come back up to Seattle in Linwood to work there. And when I went to talk to the practice manager about it, I'm going to have to leave. We have to move back up to Seattle. She's like, no, we can work this out. We can figure this out. And so, yeah, I was actually able to, back in the day, we were using Skype. I was able to work remotely and teach the classes and the patients and stuff pre and post op through what I would call telemedicine back in the day. So that was a wonderful experience as well. Very challenging, but well worth it. I actually enjoyed it a lot. So since I got the bug to work from home, I've always sought, opportunity to work from home and hang out with my dogs, right? And I've been following Carnivore. My Carnivore journey started right when I moved from Maui. I know, moving a lot. Moved from Maui. I lived on Maui for about 5 years. Back to the mainland. Then COVID hit, and I did catch COVID. Kind of felt like the flu. Went through menopause, got COVID, moved to a cold, frigid place, Eastern Washington, Northern Idaho, no sun whatsoever. Everything hit at once. And that's when I thought, okay, there's something to this. I'm going to, I thought I was doing all the right things, right? And when I did Carnivore, I thought, wow, all right, this is really helping me navigate my hormonal changes, my mood, the seasonal depression I was experiencing. Boy, it was a great tool to have in my toolbox. It really was. And so I also underwent a breast explant surgery in 2021. And if it wasn't for Carnivore, that would have been a horrible detox to go through. So that was a challenge as well. So like I said, everything hit at once. But if it wasn't for Carnivore, I would have not have sailed through as well as I did. So yeah, that's a little bit of my history.
That's quite a bit of stuff there. And yeah, I met JJ Virgin for the first time, I think at the Hack Your Health thing last year, I think it was. I want to say that. Yeah, so I enjoyed talking to her. She's very much, very obviously fit and probably has a lot of good things to say, I would imagine. And then you said Linwood. So I live in Snohomish, Washington, which is, you probably, if you know where Linwood is, where I'm
I
towns
do.
away.
Yeah, I know exactly where. I love Snohomish, actually. Yeah, I love it up there.
That's a neat little town. Yeah, I like it out here. So you're in Colorado right now. Okay, so you've got obviously a lot of a well-rounded background, and it's kind of interesting. Lauren Cordain, when he was at I think Colorado State, or think it was I think he might have been at CSU. I can't remember where he was, but one of his students, a guy named Mark Smith, this is back in
Mhm.
the early '90s, was studying under Lauren Cordain, and I played rugby with the guy. And I
Wow.
remember he was in there talking about like microdoses of exercise and eating this weird paleo diet. And this is back in like 1994 or something like that. And I was like, well, this is kind of weird, dude. And it turned out, and I talked to him years later, and it was kind of funny that I was introduced to that way back then. I
So
didn't
funny.
really pay much attention to it way back then, but um, then Rob Wolf was also one of his students later. I think just before Mark was there. But
Yeah.
so okay, so as you mentioned, we're probably of similar age. I'm almost 59 now, and so I have been into the nutrition stuff maybe only just about 10, a little more. I'd say closer to 15 years now. Now that I look at all the stuff I've been doing, and it's quite interesting. Working at a bariatric clinic, obviously, and I don't know much of it is obviously going to be, some sort of gastric bypass,
Mhm.
vertical sleeve
Gastric sleeve.
gastrectomy, lap bands, all the stuff they've done over the years.
Mhm.
Um, and it's for some people that's a last resort, and for some
Mhm.
people it's helpful, but I just don't think that's the
Mm.
magic solution for a lot of people. Just like the GLP-1s have become sort of
Mhm.
now the thing that ever the hot thing as of now. And I think what we'll see is a lot of people having problems with that as well. That we'll have to still. I mean, at the end of the day, it still comes down to, you know, eating appropriately, being active. I mean, it's just the hard work that you got to put in there. And I don't know. I don't know that it's that hard work. I think it's really.
It's heartbreaking because 80% of bariatric post-ops regain their weight back. And now many of them, instead of getting revisions, they are just getting on GLP-1s, which is a much better option than, a revision. But
Yeah, I mean, if it
still.
comes to taking a drug for the rest of your life or having your gut scrambled, cutting
Mhm.
parts, vital parts of your anatomy, I'd choose that. I mean, I think it's still a better
I
option. But
know.
but again, there's yet a better option than that, in my view.
Mhm.
Because we have, and you may have some of them. We have some bariatric patients in Rivera. We've got people that are 400 or 500 pounders that are losing, you know, hundreds of pounds doing it. So I
Yeah.
mean, you can do it a lot of different ways. And one is comes with the least amount of side effects, and probably is the I don't know, maybe the healthiest option, I suppose.
Mhm.
So how long have you been with us?
About the same time as Francesca, so since October. So we were the first coaches after Rance and Krista.
Okay, so you guys are getting close to a year now because we're in
Mhm.
we're in we're in August here. What are some of the things you've seen, and how has it might have been different from working at the bariatric clinic or some of the other jobs you've had? Hey, folks, it's Dr. ShawnBaker here. Hey, if you or someone you love is suffering from chronic disease and you're tired of just managing symptoms with potions, pills, and procedures, I want you to check out Revero.com. Our team of dedicated professionals is committed to tackling the root cause of your issue and finally getting you healthy. Hurry up, though. Our spaces are filling up very quickly.
I am having so much fun. I am having so much stinking fun. This has been such a cool. I'm just having so much fun. It's very challenging. We get folks with a lot of different conditions, a lot that we don't treat, but I have been seeing, in my experience with my caseload, I've been seeing the folks that have metabolic disease, like my type 2 diabetics and things like that, they respond the best. They're the ones that are just losing and getting off their insulin and their medications and feeling great. It seems like the folks that are still struggling with autoimmune, Hashimoto's, and my menopausal gals or perimenopausal gals, they're the ones that need a little bit of tweaking still. It's kind of a, trial and error with them. But once we find that sweet spot, boy, it's just poof, it just works. But yeah, they're the ones that take a little bit more work, I think. Any autoimmune will. So.
Yeah, I mean, those autoimmune's a challenge one, and obviously, almost all women, they assume they live long enough are going to go through menopause, and so
Mhm.
that is a challenging group to work with. I mean, and I feel, I'm glad I'm not a woman to deal
I
with
know
that,
you're so
but,
lucky.
but I mean, I guess there's some people talk about andropause and stuff like that, and I think that's probably
That's the
still this
thing.
lifestyle.
Yeah.
Some of it has to do with the lifestyle for sure. Um, so then I think the interesting thing is the access and the interaction that the coaches have with the patients. I mean, it's an ongoing thing. It is high contact, a lot of time you get to spend. Whereas, when you work, like I can tell you as a physician working with a patient, I mean, not only do you not really even get a chance to talk about nutrition and lifestyle because you're too busy, you just don't have time for that. But it's like once every 3 to 6 months. I mean, it's just like, what the hell can you do in that? I mean, hey, go read this book and come back to see me in 6 months. Not very effective. So how has been the interaction with the patients gone for you?
I love it. We've got our high touch folks, that I'm communicating with every day, in the chat. And then I've got my folks, I'll check in once a week and they're like, yeah, I'm doing great. Thanks. I'm like, any changes, anything I can help with? No, I'm awesome. This is great. Thank you. So yeah, it's really funny, you just meet people where they are. Some folks do need a lot more attention. It's funny, we get the guys, I call them the bros, that follow you. And oftentimes they're heartbroken, or they follow, Dr. Barry or, Carrie out of Wisconsin, Healing Humanity. And they're shocked when, they do have conditions still that they're struggling with, right? And what I tell these, mostly men, I say, you still have some conditions here that we're trying to address. And this is why we may need to give up dairy, or this is why we're going to give up eggs for a little bit, but then they see you on, social media and they're like, yeah, beef, butter, bacon, eggs. And so sometimes it takes a lot of navigating through what they see out there on social media versus how we can treat them individually and why we need to eliminate some of these things until we get to the root cause of what's going on. So that is a fun little subset of folks that, again, try to emulate everybody on social media and like, well, those guys have already gotten over their conditions. They're healed. Let's get you there, and we'll see you on the other
Yeah,
side.
I mean, it is some social media can be, it's a very two-edged sword because
Mhm.
one, there's a lot of people that are just totally full of BS for one, that, and there's a lot of stuff that's going on behind the scenes. It's not being displayed. For instance, like some people will say, oh, well, use me as an example. I put in a lot of work. I mean,
Mhm.
yes, I eat a carnivore diet, but I do a lot of other things, as far as my lifestyle goes. I mean, very meticulous with my sleep, very meticulous with my training. I don't take drugs. I know people are like, oh, you're taking steroids. I'm not, but I mean, that's something that I put in a lot of work, and it's not easy. I mean, I wouldn't be where I was if I just ate a carnivore diet. There's no way. I mean,
Right.
and that's real. And I try to impart that on people because I get to see, all the patients that come to Revero, if they want to, I have a weekly meeting with them,
Mhm.
and we have about 50, 60 typically people show up at a time. And, I go through questions, and one of the things I try to encourage people is, yes, you're on a health journey, but that's not the end of the journey. You want to continue, and once you because you think about it, it's like, people have a lot of regret. And they're like, well, I wish I'd done this or that. I wish I wasn't ill, and then I could have done all these things with my life. Well, then you give that back to them. You give them their health back, and they're like, okay, what are you gonna do now? You've been dreaming about this, so let's go make
Mhm.
it happen. And that's the whole point. Is like, I'm 2 weeks. I'm going to enter my first track meet. I've never done track before, but it's like, why not? Why not get after it? So
Right.
that's part of life, having fun, having experiences, and being able to, having the capacity to pick and choose what you might want to do. Some people,
Mhm.
it becomes so narrowed where their capacity is like, all I can really do is kind of walk around the house and watch TV. That's not a life, as far as I'm concerned.
Right, right. Yeah, just knowing that you're helping people get their life back and their quality of life back, and so they can, and finding out their main why. Oftentimes people will say, "Oh, I just want to lose weight and feel better." I said, "Well, what does that look like to you? What's going to change when you get there? Can you envision yourself doing some different things?" And so that's where health coaching comes in versus just being a dietitian nutritionist or a functional nutritionist, where you just kind of tell them what to eat and you help them envision what their life's going to look like once they do all the work. And it's really cool seeing them come from the other side. In fact, if you don't mind, I just got a chat from one of our patients. This is so sweet. And she'd been with us for, it's here on my phone, sorry, it's on the app. She's been with us for about 6 weeks. And I'll fast forward through all the stuff, all the it says, okay, she goes, the other thing I notice when I'm hungry and I chow down on a couple of burgers or a steak or some beef shanks, which I love, I feel so good afterwards. My waist has gone down by 1.25 inches, which is so exciting, exclamation point. I feel really good in general. I like the way I look now. I spend so many years avoiding the mirror. Now I feel cute. Isn't that fun? So yeah, again,
Yeah,
the
I
fun
mean,
fact.
and some people will say, well, and this, you don't need a team to support you, and that's true for some people. For some
Mhm.
people, sure, but I mean, there are a lot of people that this level of support is pretty much a requirement for them, and it's just something that, and as you mentioned, you learn a lot because you can have a general guideline which works for a lot of people, and then there's some things you have to adjust, and or just learning new skills, and you're probably learning yourself, I would
Mhm.
imagine, after. And this is something that I learn from a lot. I learn from patients all the time, and you learn different ideas and different things, and you see how things react, and not everybody reacts exactly the same. um, have you had to change? I mean, I guess, what have you learned over the last, I guess, year since you've been working with Revero?
I have I have learned that people are coming from so many different places in their health journey. Um, that's the big one. I've also learned that here's the big, actually, I take that back. Here's the big aha moment that I have received since working at Revero. By the time folks get to us, they have tried almost everything. They've tried almost every specialist, every pill, every doctor, every lab test, everything, right? They've tried all sorts of diets, they've tried everything. By the time they get to us, they've been through the mill, right? And I have to take that into consideration when I'm, onboarding someone or talking with someone or chatting with someone in the app, because a lot of times, they've just been put on more and more meds, or they've tried all these other supplements, and I've got to realize that sometimes emotionally they're very triggered still. They're very apprehensive, like, well, what if this fails for me? Um, but what I have seen is that when this diet is like the best blank slate ever, it's the best elimination diet ever, right? It enables us to get rid of all the fluff, no pun intended, get rid of all of the layers of meds and inflammation and disease, and get down to the root cause. And I really feel like this diet is the best way to really dive in and figure out what's going on with someone. That's what I've learned.
Yeah, I mean, yeah, obviously there's all different types coming in with different experiences, and a lot of them, as you're absolutely right, they've tried everything and it's never had success. How is it, because obviously we have our health coach, we also have our providers, our MDs, our nurse practice and stuff like that, the clinicians, which all pretty much are, amenable to carnivore diets. Many of them are on them themselves, and or keto diets or something like that. That's got to be a contrast to the physicians you might have worked with in the past. How has that been? How is it having physicians that are actually supportive and not saying, "Oh, this crazy diet, and you got to, cholesterol, this and that, saturated fat"? How has that been?
I love it. I love having the providers. They're of the same mind. I feel like finally I found my tribe, right? They're just amazing. They'll pop in, they'll assist, they're nimble. I just really love working with providers here at Revero. It's just such a breath of fresh air. It really is. It's so nice to find a tribe and we talk the same language.
You use the word nimble, and I was talking to one of the providers the other day, and he was talking about, yeah, we get a patient with an episode of pretty high hypertension, and we were able to basically contact them right away
Mhm.
and figure out what's going on. Whereas in the normal system, that would have gone maybe it would have never been noticed. Maybe it would have been 3 months before anybody even did anything about it. Do you find that you're able to make adjustments in a fairly quick fashion, with the physician like coming off meds and making adjustments to the plan?
Absolutely. Like I said, breath of fresh air. Like I just got this wonderful chat from a patient. I just reached out to her this morning. It's such a quick response. It's just refreshing to have that more hands-on feeling, and to have that. Even with the providers, they're so responsive. So yeah, that's a big part of Revero is having that I love the word nimble. We're on our toes. We're able to reach out. We're able to answer. We're able to collaborate. In the DMs, like, hey, I've got this patient so and so. This is what they're experiencing. What do you think? This is what we've been doing. It's just so fun to have that collaboration within the tribe.
Yeah, and I see a lot of the traffic because I'm on all the Slack channels, and I see a lot of the back and forth between the tech team. We've got a tech team which is always making
Well, they're
adjustments
fast
too.
too.
Yeah, they're
Hmm.
fast too. It's pretty cool to see. Credit to my partner Masa, who's helped set some of this stuff. She's done a wonderful job
Yeah.
as a CEO for this, and more
Mhm.
to come. I'm looking at the business development plan coming out, rolling out for the next few months, and it's pretty impressive at where we're going to be going. And I think we're going to I think the next coming years are going to be really exciting at Revero as we're going to really change a lot of the ways around healthcare. And it's no longer business as usual, which is just the disease management, pill for every ill for the rest of your life model, which I think a lot of people are sick of, including providers.
Yeah,
I think a lot of people are getting
absolutely.
tired of that, particularly the patients. So, um, well, I don't want to go too long. Let me ask: is there anything else we didn't chat about that you think is important for people to know? Who's Revero? Who do you like to see? What would you tell people that are on the fence about this sort of thing? What would be your say why they should consider doing Revero for at least a few months? Because a lot of people, and again,
Mhm.
this is something people don't understand. Our mission is not to keep you on Revero for the rest of your life. It is to
Right.
fix your problem, attack the root cause, get you healthy, and
Mhm.
get you gone,
Yeah.
to a normal, happy life. So what is your thought on people that might be like, I don't know if I should do this or not?
You get a provider, you get a health coach, you get the community meetings on Tuesdays with you. Um, it's so personalized. I have never worked in a clinic or a healthcare facility in which you have people at your fingertips. Like you were saying, you've got to make an appointment, a month down the road for a follow up. And, if you're lucky, you get to talk to the PA instead of the doctor or something like that. I encourage folks, if they are on the fence, if you have some conditions that are just not getting better with what you're going through and you want your life back, this would just be a wonderful way to go about it. It's actually, it's affordable compared to a lot of other concierge programs and healthcare programs out there and weight loss programs out there, which we're not all about weight loss, but yeah, I would just encourage folks to join us, hang out with us for a couple of months, a couple of 90 days, 6 months, and really allow us to help you dive into the root cause. And oftentimes the root cause can be something like trauma too, a very traumatic. I mean, we can get that's a whole nother it's a whole nother podcast. But in my experience, especially in the bariatric world, a lot of folks that become extremely obese that use food for medication or self-medicate with food, there's been a lot of trauma. And once we peel away at all the layers of inflammation and weird diets they've tried in the past, and we can get down to the root cause and assist them in finding some other ways to. And what I've noticed too, is that when we get folks metabolically well, their palate changes. They no longer. It's so fun to experience patients. I just had a gal, sweet little gal. She says, she goes, I was going to test it because I stopped craving sugar. I stopped craving pastries. And we went to the farmer's market and there was these gluten-free brownies. I was so happy she said gluten-free, number one. But then she said, there's these gluten-free brownies. And she says, you know what? I ate half of it. And she says, it didn't even taste good to me. She says, I didn't even eat the rest. And I thought, isn't that awesome? because so many people deal with the food noise and food addiction. So that's what I also love about a carnivore based or meat based lifestyle or even paleo, is that we can help them reset their palate once they get metabolically well.
Yeah, it's it's interesting because there's people that are deep into it and they're like, I could never not have this food,
Mhm.
mouthfeel addiction in my life. I just couldn't imagine a life without that. And pretty reliably, when you cut that stuff out for a period of time, you feed yourself appropriate nutrition. You're like, yeah, I don't miss it that much. It's kind of funny, and people just
It
don't
is.
get that. But sometimes it takes, like I said, I think that when you're dealing with chronic disease, very often you're dealing with some maladaptive eating behaviors, food addictions, and things like that. And you gotta address that stuff if you think if you're gonna have any success with the chronic. It's not the only thing you got to do, but if you don't address it, it's like a three-legged stool. You pull one of those chair
Mhm.
legs off, and it's gonna fall down every time. So you gotta address that thing.
That's what I noticed in the bariatric field was that, yeah, we could operate on your stomach and take out three-quarters of your stomach,
Mhm.
but it's still not operating on your trauma, your brain, your emotional, your emotional addiction to food. And oftentimes we see that their addiction transfers to another addiction, and so it. Again, you're right. It's like getting them or encouraging them to get the mental help that they need and the therapy that they need, is key for sure when we're dealing with those kinds of patients.
Well, absolutely. Well, Michelle, this has been wonderful. It's
Thanks.
wonderful to chat with you. It's even more wonderful that you're part of our Revero team. Thanks for being such a great coach and bringing your insight and helping the patients. And I know you're having fun, which is great. This is the other thing that's really cool is if physicians are they're having fun. It's medicine is fun again. Taking care of people is funny. It's not this drudgery of constant pills and complications and unhappiness. This is
Right.
joy and happiness. So good for you.
Thank
Anyway,
you.
thank you for doing this. We'll talk to you soon again, I'm sure, Michelle. Bye bye now.
Thank you for having me. We'll chat soon. Bye bye.